more often than not, one is asked to keep his mouth shut. One can have his food with very little mouth opening, and one can talk, one can even gossip with almost minimal mouth opening. Then why should we be worried if the mouth is not opening wide? We need to open it wide many a times, like while having golgappe or having king size burger. Sometimes while yelling also the mouth gets wide open, like a teacher scolding the student. We doctors also many times ask the patient to open his mouth wide to have a look at the throat. So if the mouth is not opening wide, then it is indeed a problem. Let us see if it can be dangerous also. Restriction in mouth opening can be because of multiple reasons. These restrictions can be temporary, or they can be long lasting or even permanent. Temporary restrictions can be seen after, say, tooth extraction, or if there is any infection in the tonsils. Many times it happens after injury also due to muscle spasm and pain. The arthritis, like it affects our knee joints, everybody knows arthritis of knee joints. It can also affect the joint of our jaw, this joint which is known as the temporomandibular joint, or simply TM joint. So TM joint arthritis leads to prolonged restriction, sometimes quite severe restriction. It does respond to treatment but might recur also. The restrictions in mouth opening that we cancer specialists are worried about come in those who are chewing tobaccos. Smokeless tobacco or chewing tobacco is very common in our country. It is unfortunate. This tobacco chewing leads to injury in the inner lining of the mouth. This injury, when heals, leads to a little stiffening like anywhere else, and this cycle of healing and injury slowly and steady ultimately leads to severe restriction in mouth opening. This is known as submucous fibrosis. In this situation, the normal lining of our mouth, that is pink, becomes white. The treatment of submucous fibrosis unfortunately is very frustrating. Injections of steroids or jaw stretching exercises can halt its progression, but once it is established, then it is very tough to treat. It can be treated by dividing the band that is restricting the mouth opening and putting either a skin graft or a flap there. But as I said in the beginning itself, the results of treatment of submucous fibrosis are not very good. They are frustrating. But here, when we are discussing about cancer, we are more worried about the mouth opening restrictions that happen in cancer. More important and worrisome part of submucous fibrosis is that it is a well-established risk factor for development of cancers of mouth. So if anybody around you who chews tobacco starts having restricted mouth opening, then you should be alarmed. In a patient who is already affected with cancer of oral cavity, if he starts having restriction of mouth opening of recent onset, then it is generally a gloomy sign. Most of the times, this restriction in mouth opening indicates that the cancer is growing upwards and has reached dangerously close to the skull. When it reaches that area, it involves the muscles of chewing, and in that situation, the mouth opening becomes severely restricted. When a cancer reaches this stage, then most of the cancers cannot be cured by surgery. So it is a bad situation. However, as we just said, submucous fibrosis is also associated with cancers of mouth region. So it is quite possible that the submucous fibrosis is causing restriction of mouth opening and we are having associated cancer. So if somebody is having mouth opening restriction with cancer of mouth, then he should be investigated further. Like we said in our video where we discussed the signs and symptoms of cancer, we had said that any change that comes recently is more alarming. Similarly, here also, if the restriction in mouth opening is recent, then it is dangerous. So if we ask ourselves that can mouth opening restriction be a signal of dangerous cancer, the answer is a definite yes. Submucous fibrosis and oral cancers, as we all know, both are tobacco related cancers. So we can stay away from these both problems by avoidance of tobacco chewing. If somebody is already caught by this bug of tobacco chewing habit, then please quit. We can save ourselves from deadly cancer of head and neck by staying away from tobacco chewing. With all this, I wish every cancer patient a speedy recovery. My email address and phone number for teleconsultation is written in description. Thank you. Namaskar.